Before we opened the radiology diagnostic department, it took us a long time to choose an X-ray system. We consulted with many radiologists in Novosibirsk. We were looking for a special device, compact, accurate, with a unique feature of being able to make full-size images. In the end, we settled on the best option, namely Agfa's DX D300.
It is very important to me as a manager that all examinations are performed quickly and with a very high quality. This is facilitated by the fact that the exposure position is set by default. This considerably speeds up the process itself because the radiographers basically have only to press a button, and if the position has to be changed, they can do this very quickly.
We have up to 50 patients a day. We have to perform not only chest X-rays, but we also see patients requiring neurological and trauma examinations, as well as full leg, full spine examinations. What is the advantage of this device? It's stable quality, which eliminates the need of re-examination. This is especially important when working with children who are among our regular patients.
The fact that this device has a U-arm is very convenient. Often, when a detector is positioned on a separate wall stand, some difficulties can occur, which is not the case here. We can choose an angle of the fully digital detector and of the X-ray tube. This is important for heavy patients. We can position the detector in any angle, whether a patient is lying down or sitting in the required position, and take a high-quality, accurate image. At the same time, the distance to the examined object allows us to take images at a maximum distance, irrespective of whether we're looking at standard objects, big ones or small ones. This is very important, for example, in pediatrics. I would also like to draw your attention to this full-leg, full-spine stand, which allows us to do full spine examinations to determine the grade of spinal curvature. And you can also do examinations of the entire length of the legs. There is a special grid behind the scale on this stand, and the system itself takes the necessary number of images and automatically stitches them according to this grid, which makes it possible to prevent any shift by even a fraction of a millimeter. The reliability of the measurements is the same as that of the ones we made on earlier machines, where we had to use a high focal distance to image the entire spine.
This unit allows us to interpret the images in such a way that we can make a definitive diagnosis. Adjusting sharpness and contrast can be done by means of computer processing, so further examinations are not required.
If we have any questions about the use of the system, we can always count on the wonderful specialists of the company Siberian Success, who are on call 24 hours a day. As a result, our professionalism and competence have been enhanced, particularly among our radiographers.
We are now in Krasnoyarsk, in the PharmSibCo private clinic. A new X-ray unit, manufactured by Agfa, model DXD300, has been installed here. It is ideal not only for private practices, but for any radiology department. The radiographers devote minimal time to mechanics and preparations, and maximum time to the patient himself, allowing them to take high-quality images as quickly as possible. On this particular unit, on workstation, we have installed new software, Musica 3, which is state-of-the-art image processing software. We achieve excellent image quality with a lower dose, which is undoubtedly very important.
This is a multidisciplinary medical center and also the largest diagnostic radiology department in Krasnoyarsk. The department is equipped with the most advanced X-ray equipment. We have been working with Agfa for quite some time. We use their printers, and we also have Agfa CR for mammography. In addition to that, We have installed Agfa's new X-ray digital low-dose system. This unit has enabled us to examine various groups of patients, ranging from children aged 0 to seriously ill bedridden patients.
Here we have added age groups. Why is that necessary? It allows us to set specific exposure parameters, depending on the age of the patient. We have a 43 by 43 cm full-format flat panel detector, plus 2 grids, since the focal distance can be set between 1 meter and 1.8 meters. The detector cannot be damaged, because first, it is a built-in system, and second, because it is equipped with sensors. If something interferes with the movements of the device, it will stop immediately, and the unit will remain in the same position until the radiographer removes the obstruction.
Thanks to new image processing algorithms, I immediately noticed higher image quality. All necessary information on the patient can be entered very quickly, and it can be quickly pre-configured prior to any examination, even remotely.
As you can see, by simply pressing a button, we can move the device to a completely different position. Here on the collimator, we also have LED lighting. It can also be set up for any type of examination. Additionally, you can switch on the laser here. The collimation field is crystal clear. The LED lighting is more long-lasting than the standard one.
The presence of an official representative in Novosibirsk and flexible delivery terms played a significant role in the choice of the DXD300. The preparation of the room, the installation of the device, and the training of specialists went smoothly, with constant support of Agfa specialists.
Everything works fast and efficient, which is especially important for emergency examinations. We occasionally have to carry out such examinations, perform a quick diagnosis, and determine the correct treatment. As a manager in a private clinic, it is very important to me that we can examine as many patients as possible within 1 hour. This device is really good.